Welcome to the Dairy News and Views podcast, a production of the Iowa State University Extension and Outreach Dairy Team. Our podcast covers current educational, research, and industry tools available for your operation to manage healthy cows and calves while producing the highest quality dairy products.
Well, thanks for joining us on today's News and Views from the ISU Dairy Team. So I'm Larry Trennell, a dairy field specialist with Northeast and Southeast Iowa. And joining with me today is Jen Bentley, our Northeast Iowa dairy field specialist, and Dr. Jan Shear, Dr. Phil Jarden, as basically we recap a presentation that you guys did delivered on a topic of lameness. Okay, so that's kind of the topic of our podcast here. So Jen, welcome. Dr. Phil, welcome. And Dr. Jan, welcome.
Thank you, Larry.
Thank you.
So before we get started on the discussion of lameness, would you mind just each one of you giving the audience a little bit of background of yourselves and your work as an extension veterinarian?
I guess I'll jump in there. Real quick, I am current extension vet at Iowa State University. I've been here since 2009. Prior to that, I was at primarily most of my career spent at the University of Florida as a dairy extension veterinarian, and moved here in 2009. My interests are in particular bovine lameness and welfare issues of cattle.
And here I thought you moved back because of the cold weather. But
that's just a bonus.
Dr. Phil, how about you?
Well, I also was kind of crazy and moved from California to Iowa last year. I've been here about 5 months, and I'm kind of the designated replacement for Jan, and he retires in a few years to be the new dairy extension dairy veterinarian specialist. So yeah, the 11 years before I came here, I was working for Elanco Animal Health in California. And before that, had several roles in industry and academia. And now I'm excited to be back at Iowa State and have a particular interest in transition cows and baby calf stuff. So this talk kind of fit together with Jan and I, with my interest in transition cows and his with lameness, kind of fit together well.
Well, we're glad to have both of you. So I've just got a few questions. One of the first questions is why do we see more lameness in late summer and early fall compared to other times of the year?
Well, I'll start with that one and let Jan chime in. A lot of it we think has to do with the heat stress and the temperatures and what the activity of the cows. So when you think of cows that are hot, they don't lay down as well, so they're standing more than they need to be. We also see, fly pressure, especially stable flies. If they're biting cows, they're less likely to lay down in that middle part, hottest part of the day. So we're pretty sure that's a big part of it. Jan, do you have anything to add to that?
No, that really is the issue. I think as Phil has described here, we see more lameness. So you can see this is true pretty much throughout the country. I've looked at incidence rates, and whether it's here or it's Florida, out west, wherever you are, you see this very typical pattern of greater amounts of lameness in the late summer and early fall. So it's very, very much a seasonal related kind of problem.
Okay. So what are some of the reasons that transition cows seem like they're more susceptible to lameness?
Yeah, that's an interesting one. It's really maybe not, they don't get lame right after calving. It's a couple months later that we see it, but it's probably things that the way we managed them right around calving and then some hormonal changes that happen. So there's a couple of hormones that are increased right around calving. There's estrogen, and then there's an interesting one called relaxin. And just like the name sounds, it's kind of designed by the body to help relax the pelvic canal so the calf can come out more easily. But it doesn't have a specific action on just the pelvis. It also works on the ligaments and structures in the foot. And so it's really important that we have those close-up cows and fresh cows able to lay down and get off their feet as much as possible, because that just puts too much pressure on them.
That's exactly the point, I think, is that we see this stress on the suspensory apparatus of the bone that's within the claw horn capsule, or within that claw horn shell of the foot. You see the bone is actually suspended normally within that claw horn shell. And the suspensory system is all soft tissue, of course, is all soft tissue beneath. And so when we get these hormonal changes that occur, it stimulates enzyme activity, in other words, that will relax more, or I should say more, it actually weakens that suspensory system of that bone that's within that claw horn shell. And when that happens, then the bone will sink. When it sinks within the claw horn shell, what it ultimately does is compress all the tissues beneath that actually are responsible for the production of a horn in the sole and so forth. And that becomes the initiating a reason or factor in claw horn lameness.
Okay. Yeah, I appreciate that. So we also know that like body condition affects a big major impact on cow health. So if too thin, you see the decreased milk production, reproduction. If it's over conditioned, it might experience some of the similar issues, or some metabolic issues, especially if she's transitioning. But what effects might body condition play on hoof health?
There's twofold, actually. So when you think of too heavy of cows, just like too heavy of person, I know when I get a little bit overweight, my joints get a little bit more problems. And it's just harder to get up and down. So overweight can cause that, and then just mobility problems. But on the interesting side, too thin can also be a problem, because that fat pad that's underneath those structures that Jan was just talking about in the foot are part of what helps cushion that. And if the cow gets thin, that's one of the places that the fat leaves, and that's an important part of that foot structure there to help buffer that, help cushion the blow as the cow walks.
Any other thoughts on that, Jan?
Yeah, and so just as Dr. Jarge described there, the supportive structures, that is the structures that are actually beneath the bone within that claw horn shell, again, within the hoof. The supporting structures are all soft tissues. It's the connective tissue that makes up what we call the corium, or the dermis, the part that has the nerves, in other words. And then also the digital cushion. And the digital cushion really functions as the claw's shock absorber. And when it gets reduced in size, whether it's due to a disease, or even could be early lactation, where we have excessive mobilization of fat in the body, it also mobilizes it away from the digital cushion, which is a fat pad, right? And so what happens as it gets smaller and thinner, the cow becomes more susceptible to lameness.
So what would you describe when you talk about lameness, just the primary causes of lameness itself?
The primary causes of lameness would be sole ulcers, what we call white line disease, and foreign bodies that can occur within the foot. That can be a multitude of things, of course. And then we can also have punctures in the sole, all of which can abscess, but all of which would be incorrectly termed. And this is one of the things we work with veterinary students and others, is to try to avoid the tendency to want to call all these things abscesses, sole abscesses. What's really more important for us, if we're trying to track down the cause of these lesions, just as we've described here so far, we need to know what is the exact lesion. Is it a sole ulcer? Is it a white line disease? Now, is it a foreign body in the foot? And then the other conditions that occur in the foot that have more of an infectious nature would be, the conditions of foot rot, which is a generalized swelling and infection in the lower foot beneath the fetlock on down. And also we can get, of course, digital dermatitis or hairy heel warts, as it's more commonly known.
Dr. Shearer, one thing you taught me in the past is about where the cows gets lame and why that happens. So on the hind foot, it's outside, and outside. That's our biggest. If we're going to get lame in one of the claws, it's the outside claw and the back foot most commonly. Can you explain why that happens?
Yes, and so with I think, and the thing that, of course, what Dr. John's referring to there, I always say, and this is not my saying, but it's one that I've always remembered from over the years, is that 90% of lameness is in the foot. 90% that's in the foot is in rear feet. And of that, roughly 70 to 90% or so affects the outer claw. And so what that kind of tells us is that much of the lameness condition that we see, many of the lameness conditions that we see, have more to do with cow comfort type issues, hard flooring surfaces, and those kinds of things. Possibly not as much to nutrition. And of course, that's good news for nutritionists most of the time, because over the years they have been typically blamed for lameness disorders in cattle. And in fact, what we understand now more so is that some of these other factors are possibly as important or possibly more important in the cause of lameness.
Yeah, that if it's all acidosis causing the problems, they'd be more likely to be all 8 of those claws, not just those outside 2 on the back.
Yeah, exactly. That's exactly the point. Is that if this was really due to nutritional factors, the shower of endotoxins, which is one of the purported underlying causes, it wouldn't be just to the outer claw, but it would affect all claws. And so it makes a sense that there's more to it than just how we feed cows.
So as you mentioned that, it makes me kind of think of like hairy foot warts, digital dermatitis, and the relationship of that to the long-term foot health. Any comments there?
I don't know of any relationship between those two, because hairy heel warts and foot rot are true infectious disorders of the foot. And the conditions that we've been talking about here prior to this, the sole ulcers, the white line disease, and these traumatic lesions that occur within the sole, those are all mechanical, physical, and metabolically related conditions. And so, yeah, that is a very important distinction, because when we're treating claw disorders or hoof disorders, rarely do we need antibiotics. It's when we get to these infectious conditions like foot rot that might require or be improved with some antibiotic therapy.
Yeah, do you think there's any other anatomic factors relevant to lameness that maybe we should mention as well, or did we pretty much cover it all?
I guess I'll take that one, Bill, and you can kick in some ideas here too, relative to these things we've talked about. But what we've learned in recent time is that when we look at the lower leg, and particularly the foot, we see a pretty significant difference. And I'm talking about the rear feet now. We see a pretty significant difference in the size of the outer claw. And we also noticed that compared to the inner claw, that is. And then we also noticed that when we look at the weight-bearing surface, the weight-bearing surface of the outer claw is much flatter. It's much more stable, in other words, whereas the inner claw is much less stable. And when you think about it, the weight comes down through the center of the foot, right? And so it would be naturally distributed equally, except for the fact that you have in this inner claw a more sloped or less stable weight-bearing surface. And so as a result, much of the weight will tend to roll over to that outer claw. In addition to that, we also have an anatomical difference in the metatarsus, which is just above, that also encourages a greater amount of weight bearing on that outer claw anatomically. So the cow is somewhat predisposed to these kinds of conditions because of those anatomic factors.
And we throw in the management factors that complicate that. Let's say a cow is standing in her, the free stalls aren't comfortable, so she doesn't want to lay down. So she puts her front feet up in the stalls. It's called perching, and that puts even more weight on those hind feet. So it's important to keep the beds comfortable and give them a nice place to lay down. Encourage them to do that as much as possible.
Yeah, very good points there. Anything else for the good of the cause as we talk about lameness and dairy cows? And
I just want to make a point that we see more in the fall and the late summer, and I think it's a lot has to do with that weather and the heat stress. So anything we can do to keep the cows cool, that'll make them lay down more and not be standing as much, and keep the fly pressure off.
Okay. Any last thoughts from you, Jan?
Oh, those are the key factors, I think. Right there, we are around the time of calving in particular, because we have all these hormonal and enzyme activity occurring. It's really a critical time at that in that transition period to try to make sure that we get cows comfortable, and that's especially important certainly in the times of the year like late summer, early fall, because we're really subject to more problems with those conditions for the reasons that Dr. Jardin described earlier, relative to heat stress and bunching of cows.
Yeah, so sometimes I think and every dairy farmer's got a realization, I think, at least somewhat of what lameness can cost the herd, but as an industry, boy, it's a big economic downplay on the profitability of the dairy herd, that's for sure. So, all right, well,
That's true.
Both of you joining with us today. We look forward to visiting everybody with the next Dairy News and Views podcast. So I appreciate everybody joining, and take care.
Thank you.
Thank you.
This institution is an equal opportunity provider. For the full non-discrimination statement or combination inquiries, go to www.extension.iastate.edu/diversity/EXT.